Psychiatry versus psychology. What's the difference? In this day and age, the term psychiatry and psychology are used somewhat interchangeably, and most people think that a psychiatrist is a psychologist and vice versa. And in reality, in the mental health field, they're two very, very different professions. And so in this video, I'd like to explain to you the difference between psychiatry and psychology. My name is Dr. Johnny Psych, and I am on the quest for healthy and successful living through understanding the principles of psychology and psychiatry. Now, I do want to give a warning that this lecture is for educational and entertainment purposes only. This lecture should not be constituted as medical advice. So if you're having medical or psychiatric symptoms, please consult your doctor. And if you're experiencing any acute distress, please go to the nearest emergency room or call 911. And if you need immediate emotional help, please call the National Suicide Hotline at 1-800-273-TALK. Make sure you hit the subscribe button below so that you can get more videos just like this. So, psychiatrist, psychologist. Well, let's first talk about the similarities. Well, first of all, they are both doctors. Second, they both treat mentally ill patients. And third, they both tend to work in hospitals or in clinics. Four, they often have their own private practice. And five, they often work together on a team to treat their own or a panel of patients. And then we get to the differences. So a psychiatrist, they are medical doctors, which means they went to a 4-year medical school. They have an MD or DO degree. And after they graduate, they attend a 4-year psychiatry residency. And ultimately, they can prescribe medications while sometimes they do therapy. As for psychologists, these are people that went to graduate school. They have a master's degree, and then they go on to get their PhD, or some get a PsyD, and they usually write a dissertation. And I'll explain what that is later in this video. And most of them actually specialize in psychotherapy, but they can also do psychological assessments. So let's first talk about psychiatry. So the Merriam-Webster Dictionary defines a psychiatrist as a medical doctor who diagnoses and treats mental, emotional, and behavioral disorders. So a psychiatrist, after they graduate from undergrad college, they will apply and get into medical school, and they'll attend medical school for 4 years. And in medical school, they'll study human physiology, human anatomy, human diseases, pharmacology. They'll study all the stuff of normal doctors. And they'll even do rotations in internal medicine, pediatrics, surgery, OB-GYN, and of course, psychiatry. And then they will graduate the medical school, and then they'll get a medical license after passing the USMLE Part 3, and then they will complete a 4-year psychiatry residency. And this gets them board certified in psychiatry. Now, during this 4-year psychiatry residency, they will do classwork, which includes learning about psychiatric illnesses, learning about medication theory, as well as learning about psychotherapy. But mostly, they'll be doing practical work. They have practical work experience under supervision, and they will work 6 months full-time, sometimes 10 to 12 hours a day, 6 months of internal medicine and family medicine. They'll do 3 months of neurology. They'll usually do 1 year of working at a psychiatric inpatient unit. Then they'll do a whole nother year of working at an outpatient mental health clinic, as well as some rotations like 2 to 4 months of psychiatric medical consults, maybe another 2 to 4 months of forensic psychiatry. And then they can do some electives like working in the community or working for a sleep medicine clinic. And while they are working in this residency, they will learn about mental illnesses like depression, bipolar disorder, suicidal behaviors, anxiety disorders, PTSD, schizophrenia, multiple personality disorder, otherwise known as dissociative identity disorder, personality disorders, ADHD. They'll have all of this experience and get to meet and treat many of these patients with those diagnoses. And this is, I believe, one of the advantages of psychiatrists, which is that they get an immense amount of patient exposure and experience. And by the time a psychiatrist graduates the 4-year residency, most of them have treated well over 500 people with depression, treated well over 500 people with schizophrenia, treated well over 500 people with bipolar disorder, treated well over 500 people with borderline personality disorder, 500 people with PTSD. Whereas I have noticed that a lot of non-psychiatrist cohorts, especially at the beginning of their career, have not had the same level of patient exposure that a psychiatrist, just right out of residency, will have had, just due to the immense amount of exposure they get. And during these 4 years, they will learn about medications, the antidepressant SSRIs like Prozac, Zoloft, Lexapro. They'll learn about other antidepressants like Wellbutrin and Effexor, and many, many others. Anti-anxiety medications like Xanax, Klonopin, Valium, Ativan. ADHD meds like Ritalin, Adderall, and a whole bunch of others. They'll learn about antipsychotic medications like Risperdal, Zyprexa, Seroquel, Abilify, many, many more. Mood stabilizers like lithium, Depakote. Again, many, many more. And they get to treat the patients with the above medications and then follow the results. And we're talking thousands of hours of experience with these medications. And this really is advantage number 2 of psychiatrists, which is that they have this medication option. And another advantage of the psychiatrist is that he is a medical doctor, which means that a psychiatrist can also rule out actual medical conditions that might be posing as a mental condition. For example, a depression might actually be a simple thyroid dysfunction. And this actually happened to, not a patient of mine, but actually one of my friends while I was in school. And my friend Jim, who actually gave me permission to use his story, he was actually depressed and he thought he was depressed, was going to therapy and for months, and he wasn't getting better, wasn't improving. He had no idea why he was depressed because things were going okay in his life. And then he, just by a fluke, they checked his thyroid and it turned out he had hypothyroidism. And that's all it took. He took some thyroid supplements and he completely recovered. At first he couldn't believe it, that this whole thing was just simply a thyroid dysfunction. But it goes to tell you that if you don't rule out the medical conditions first, that all the other treatments may not be effective, since this really is not a mental condition. Another example is that a panic attack might really be a heart issue. I actually had another friend that was struggling with what he thought was anxiety and panic attacks. Turned out just to be a mitral valve prolapse. A valve in his heart was causing the heart to speed up. And he was just perceiving that as anxiety. And I've also had numerous situations where patients who thought they were having a panic attack actually turned out to really be having a heart attack. So it actually can happen in the other direction. Also, what some patients perceive as subjective memory loss or confusion might actually be a stroke or a seizure. And so it's important to rule out some of those, because those are medical conditions. They can't be cured by simple therapy. So ultimately, after 4 years of a psychiatry residency, when the psychiatrist graduates from this program, he will have learned through massive amount of patient exposure and clinical experience. He'll learn to be able to interview a patient fairly quickly and be able to evaluate the patient, make a diagnosis in terms of a psychiatric illness, and then recommend treatment, which usually is medications, or it could be therapy, or it could be both, or it could be some other form of treatment. And this is what some people see as a disadvantage of psychiatrists, which is that by utilizing the medical model, they will see everything as a disease. And that could be good for 90-95% of all patients, but for those cases, maybe someone's just having a bad day or a bad month at work, there is a chance for these patients to become diagnosed with a disease when in reality they're just reacting appropriately to a severe life circumstance. So for this next section, I thought we'd have a little fun and talk about some famous psychiatrists. And the first famous psychiatrist I like to think of is the famous Carl Jung, the contemporary of Freud and creator of analytical psychiatry, and the archetypes of which was used by George Lucas to create Star Wars. The next famous psychiatrist is Elizabeth Kubler-Ross, the creator of the stages of grief. You've probably heard of this, the stages: denial, anger, bargaining, depression, and acceptance. I mean, who hasn't heard of the stages of grief? This is an extremely famous concept. And it was created by a psychiatrist. Another famous psychiatrist is a man named M. Scott Peck. And he is the author of a book called The Road Less Traveled, which actually came out in 1978. But back in the 80s, when I was growing up, this book was huge. And I actually read this when it was still kind of a phenomenon into the early 90s. And it was kind of a pop psychology book, but he was a psychiatrist. Another really famous psychiatrist is Aaron T. Beck. And I always thought this was interesting that he is a psychiatrist because his theories of cognitive therapy are one of the principles of modern psychology. And yet he was a psychiatrist. Well, I thought we'd have a little fun and talk about some famous fictional psychiatrists. And of course, no one is more famous than my favorite fictional psychiatrist, Dr. Fraser Crane. He was a psychiatrist, as well as his brother, Niles Crane, and his famous or infamous ex-wife, Lilith Sternin. All three on the TV show Cheers and Frasier were psychiatrists. The next most famous fictional psychiatrist probably is Hannibal Lecter from Silence of the Lambs. He was a psychiatrist. And another famous fictional psychiatrist is Special Agent George Huang. And he is the forensic psychiatrist for the FBI on the TV show Law & Order Special Victims Unit. Now, here is a interesting quiz, which is, what was Sigmund Freud? Was he a psychiatrist or was he a psychologist? After all, he heavily influenced both modern psychiatry and modern psychology. And people automatically think that Freud was a psychiatrist because Freud went to medical school and he did earn an MD degree. And this is where the confusion comes from. But Freud was not a psychiatrist. He had no official training in psychiatry. But here's something interesting. Freud was also not a psychologist. He had no official training in psychology, although it should be said that he was around at the birth of this new field called psychology. In fact, Freud was a neurologist. And actually, Freud actually considered himself a psychologist. I bet you didn't know that. So now let's talk about psychology. So a psychologist is a PhD in clinical psychology, which actually means a doctor of the philosophy of clinical psychology. And that's really what a PhD means. It means doctor of philosophy of whatever the topic they have the PhD in. Hence, a psychologist is someone who really understands the philosophy of mental illness, someone who really gets into the weeds of understanding mental illness. And this is the advantage number one of a clinical psychologist, is that they really study the theories behind the psychiatric and psychological illnesses. So a clinical psychologist, rather than go to medical school, they actually go to graduate school. So they graduate undergrad with a bachelor's degree in psychology, and then they get into a psychology graduate school where they start off by taking about 2 to 3 years of advanced schoolwork in psychology. It's sort of an advanced level of the undergraduate classes, kind of like the next level, and then they earn a master's degree in clinical psychology. And after their master's degree, they take a few more advanced classes, but mostly really work about 10 to 20 hours a week of supervised psychotherapy while they write their dissertation. And this dissertation can take anywhere from 2 to 6 years. There's some evidence that the average time it takes someone to get a PhD is 8.3 years. So if you figure that there's going to be plenty of people that finish in less time, you can imagine how many people that spend way more than 8.3 years to finish their PhD. And that's mostly while they write their dissertation. And it's this dissertation that earns a graduate student their PhD in clinical psychology. So after this process is done, finally, the graduate student must complete a 1 year of a supervised pre-doctoral internship. And once they complete that, they are now a doctor. They're a doctor of psychology. Now, I wanted to spend a few moments talking about the dissertation, because this is what makes psychologists vastly different from a psychiatrist. And so a dissertation is basically a research project. So the graduate student will pick a very specific topic and will basically become the world's foremost expert on that very specific topic. So he may discover something new or advance that specific topic. So that clinical psychologist is basically the world's foremost expert on his chosen topic. Now, I should say that some psychologists actually have a PsyD degree where they don't complete a dissertation and they do focus a little more on the clinical treatments. So ultimately, what this produces is what I think is the biggest difference between the two. So a psychiatrist has basically a general knowledge, where a psychologist is an expert of his chosen specialty. So another way to think about it is this. So the ultimate goal of psychiatry is sort of this general knowledge. So the idea is that whether you see a psychiatrist in Los Angeles, California, or you see another psychiatrist in Kansas City, Missouri, ideally, you should get the exact same treatment. Now, of course, this is easier said than done, and it's not going to always be what really happens, but this is ultimately the goal. This idea that all psychiatrists should have sort of the same level of general training. Now, the goal of the psychologist is, in many ways, it's kind of the opposite of this. So the goal of psychology is sort of a network of psychologists, each with a very specialized expertise. And so if a very, very complex, unique problem appears, the psychologists will kind of look to this network to find someone who is an expert at that specific problem. And the best way to understand this is in some of these blockbuster summer Hollywood movies. Like you might start off with these movies start off with this scientist that's just having coffee in the morning, and all of a sudden there's this outbreak, this national emergency. Who knows? It could be an asteroid about to hit the Earth, or aliens invading, right? And all of a sudden the government helicopter comes and picks up this scientist, and the scientist is taken to some secret bunker where there's these panels of other scientists that are complete experts in this field. And this really is what happens. So, in fact, when you get your PhD degree, when you finish your dissertation and you're given any PhD, whether the PhD is in clinical psychology or I don't know, East Roman history or underwater basket weaving, I don't know if you can get a PhD in that, but let's say you get a PhD, you do your dissertation, and it's on your specific topic. Let's say it's on the serotonin reaction in depression of the rhesus monkey. I don't know, that's how specific these dissertations get. And well, to get your PhD in psychology, you actually have to sign an affidavit that says that if there's ever a national emergency that requires your specific expertise to solve that problem, and the government calls you for help, you actually have to agree and promise that you will help. That is the condition of which you're given your PhD. I always think that's really, really cool. So recapping, psychiatrists have a very broad, kind of an all-inclusive, but sometimes somewhat superficial amount of knowledge of all the vast psychiatric illnesses. Whereas a clinical psychologist, they may have a slightly narrower, a little less comprehensive amount of knowledge, but what they do know, they know it on a very, very deep level. Also, in general, a clinical psychologist cannot prescribe medications, although it should be said that some states like Iowa, Idaho, Illinois, New Mexico, and Louisiana do allow psychologists to prescribe medications with extra specialized training. And this is very controversial. It's a controversial movement since psychologists don't actually have any medical training in the event that there is a medical side effect. Some doctors argue this is actually dangerous, while the psychologists actually will state that their psychopharmacological training more than compensates for their lack of medical training. So it is a big debate that's going on right now. So since most psychologists don't prescribe medications, most of the psychologists pretty much stick with psychotherapy, aka talk therapy. But the clinical psychologist, in addition to psychotherapy, has the ability to do psychological assessments. And psychological assessments really make psychologists very, very valuable. Because let's say you're a psychiatrist and you have this patient, but you're not really sure what's wrong with this patient. Right? I mean, maybe he might be depressed, but then a small part of you wonders, well, could he really be maybe having hallucinations, like seriously having something really wrong with him? Or maybe he's just a little anxious, and that would require a little less treatment. Or maybe he's just having a bad month at work, and all he needs is just a little bit of support. But all these would be very, very different approaches to the patient and would have very, very different treatments. So what this psychiatrist would do is he would consult a clinical psychologist about the patient. And the clinical psychologist would conduct a psychological assessment on the patient. And this would basically start off with a long interview, a thorough interview that could really last sometimes more than 2 hours. He might give an IQ test like the Wechsler or the Stanford Binet. He'll also give personality testing, maybe like the MMPI-2 or the MCMI. And some psychologists will still do the Rorschach test, although this is controversial. There's some controversy as to whether the information gained in the Rorschach is valid, but I don't want to get into that controversy here. Maybe in a different video. That psychologist may also, with permission from the patient, get collateral information by calling that patient's spouse or a family member or friends, or even if the patient doesn't mind giving a release of information, might even call coworkers and friends. And after all this extensive test, which sometimes it can take 8 hours, sometimes some more thorough tests can take 16 hours or more. In some inpatient hospitals where the treatment might be vastly different, it can take weeks. And ultimately, they get a very detailed psychological profile of the individual and their level of functioning. And then the psychiatrist will take this report and will use it to inform his treatment. And this really is the ultimate point of this video, is that many psychiatrists and psychologists work together as a team to help one patient. So it's really not like these are people out there competing for the patient, but rather it's a collaborative effort where they each use their strengths, and by working together, they're able to ultimately help the patient in need. And again, for fun, let's talk about some famous psychologists. And perhaps the most famous American psychologist is B.F. Skinner, who basically created behavioral therapy. He created the idea of operant conditioning, this really simple idea that we basically seek pleasure and avoid pain. And through this has really revolutionized modern American psychology. Another famous psychologist is Carl Rogers, who created the third force in psychiatry. If you think of the first force as sort of Freudian psychodynamic theory, now that brand. The second brand, of course, is B.F. Skinner's sort of behavioral therapy. And the third force is that of Carl Rogers, this idea of unconditional positive regard and how being born with conditions of worth may be holding someone back, and that if you just have a therapist that you think really just cares about you and supports you, that you can actually use that time with this therapist to move forward in your life. This is very popular, and it is now known as Rogerian therapy. It's kind of the basic skill that all therapists must have at its core, even to just be considered a therapist. And of course, we can't forget Jean Piaget, who created his theory of cognitive development, this idea that children cognitively develop in very discrete stages. One of the foremost leaders in child development. And perhaps one of the most famous psychologists of our times, Dr. Phil, Dr. Philip McGraw, who, of course, was made famous by Oprah, but still continues to sort of be a force in daytime television and talk show entertainment. Now, let's have some fun and talk about some famous fictional psychologists. And for me, one of my favorite fictional psychologists is Bob Newhart from the Bob Newhart Show. This was really, really big in when I was growing up, and just the main character of this, he was a psychologist. Another famous psychologist is Dr. Peter Venkman from the Ghostbusters franchise. He was is a clinical psychologist. And another famous psychologist is Special Agent Fox Mulder from the X-Files. Although I should say that he actually does not have his doctorate degree, so officially he's not a psychologist, but I'm going to give it to him. And of course, there are also other famous psychologists on TV. Well, that ends my video. I hope that this has explained to you the difference between a psychiatrist and a psychologist, and hopefully helped you understand fully not only the differences between the two, but also the similarities, and ultimately understand that the two work collaboratively together to help the patient. And if you enjoyed this video, please hit the like button. Now, if you are actually thinking about going to a psychiatrist or psychologist, but haven't decided which one you should see, check out my video, Psychiatry versus Psychology, Which One Should I See? Also, if maybe you are actually interested in becoming a psychiatrist or becoming a psychologist, check out my video, How to Become a Psychiatrist, a Step-by-Step Method, and How to Become a Psychologist, a Step-by-Step Method. So that ends this video. Thank you so much for listening, and I'll see you soon.